Hello, my name is Aidan O'Connor. I'm a third-year medical student at the University of Washington School of Medicine, and I did my poster presentation on how to enhance care options for individuals with substance use disorders in Clallam County, Washington. This project is the result of my experience through RUWOP, the Rural Underserved Opportunities Program, which is a summer investigative scholarship project at the UW School of Medicine. I've hypothesized that implementing a 24/7 crisis care unit would help decrease overdose death rates within the county. Some background on Clallam County is that it is composed of a rural population on the Washington State Peninsula and is located on ancestral native lands. The basis of this project is that Clallam County has a significantly elevated drug overdose death rate compared to Washington State. And something I think important to note is that the American Indian Alaska Native population is disproportionately impacted by substance use disorders, likely due to centuries of genocide and structural racism the community has had to endure. And this is likely contributing to the elevation. Here you can see the list of community assets. It's just a snapshot of some of the resources the community has built for people experiencing substance use disorders. This community has worked very hard to create resources that address both socioeconomic and medical aspects necessary to provide comprehensive SUD care. Yet, even with all these resources, we still see elevated overdose death rates in Clallam County. So while talking with local healthcare professionals, we dove into the recovery pathway for an explanation why. In Clallam County, an individual's recovery pathway starts by the community member expressing a desire to stop using a substance. Then, the individual gets connected with professionals who can make a care plan and perform facility outreach. Then, generally speaking, the individual must wait for a bed to open up to limited availability within the state. It's at this step where many people are lost to follow-up. So this is where I focus my research for care expansion opportunities. While exploring solutions, I came across this paper about a 24/7 acute crisis care unit implemented in Wake County, North Carolina. EMS professionals were trained to identify patients who may benefit from diversion from the ED to the crisis care unit. This is a facility with peer counselors and specialized substance use disorder and behavioral healthcare professionals, providing medical care and social detoxification for those experiencing a mental health crisis. It acts as a safe place to go to during the critical first steps of recovery while waiting for longer-term care options. This paper demonstrated that these facilities could effectively divert people from the ED and exemplified how it's a great bridge to care option for inpatient psychiatric, residential, and detoxification facilities. So in conclusion, a 24/7 crisis care unit would be an effective way to prevent losing patients to follow-up while waiting for access to longer-term care facilities. They provide a safe, medically supervised space to start an individual's recovery journey immediately after someone reaches out for help. And since completing this project, I was excited to see the Jamestown Healing Center, which is run by the Jamestown's Clallam tribe, breaking ground on their 16-bed psychiatric treatment facility. You can see them pictured in this photo on the slide. This is a project that they've been working on for years now, and they've announced that they will be offering detoxification services and crisis stabilization. Coordination with local EMS services to create an ED diversion training program and protocol like the one in Wake County, North Carolina, would fill the care gap Clallam County is currently experiencing. This community is well on their way to making a bigger version of my scholarship proposal a reality. These are my references, and thank you for your time.